Thank you for watching the video. This is YouTube Medical University. Suddenly, let me ask you to imagine something. Let's say there are 6 people around you right now. Statistically, out of those 6 people, one person either has diabetes or is in a pre-diabetic state. That's 20 million people in Japan. This is the total number of people who have diabetes or are considered pre-diabetic. Isn't diabetes a disease that only affects overweight people? Isn't it just their own fault for overeating and not exercising? People who still have this outdated way of thinking are at risk. Even people who are thin can easily develop diabetes, and in fact it's been found that Japanese people are actually more genetically prone to diabetes than Westerners. So today, I'll talk about the dangerous complications of diabetes that you shouldn't overlook. I'll also share some hopeful measures you can take. What kind of disease is diabetes really? I'll clearly explain the 3 main triggers that lead to diabetes. And in the third part, I'll talk about what symptoms can appear if you leave diabetes untreated. There are actually many unexpected symptoms that are often overlooked. If you leave it untreated, you could lose your vision, need dialysis, or even have to have a leg amputated. There are many such frightening complications. Please learn so you can detect them early. Here at YouTube Medical University, we treat diabetes and we provide easy to understand medical information from a doctor's perspective. I would appreciate it if you could subscribe to the channel. So, for our first class, diabetes. What's happening inside the body? Let's start with the basics. Do you know what blood sugar is? Let's review blood sugar levels. When you eat rice or bread, it gets broken down in your body into the smallest unit called glucose. And when this glucose is absorbed and moves into your blood vessels, that's what we call blood sugar level. In other words, blood sugar is like the gasoline that powers our bodies. Especially the brain can't function without this glucose. However, having too much blood sugar is also a problem, and the issue is that it damages your blood vessels. It's also called advanced glycation end products. When this sugar attaches to proteins, it causes oxidation in the blood vessels and damages them. The real danger of diabetes is that high blood sugar puts stress on your body. That's why our bodies produce insulin to keep blood sugar at a certain level. This is the relationship between blood sugar and insulin. Up until now, I thought it was pretty difficult to explain and hard to understand. But from today, please think of insulin as a key. Every part of your body is made up of cells, and each cell has a door. Glucose or sugar in your blood vessels can't enter the cells as it is. Only when the key called insulin opens the door to the cell, glucose can move into the cell. Once the glucose successfully enters the cell, it is used as energy. The sugar is processed, and that's how our blood sugar levels go down. For healthy people, this system works well, so their blood sugar levels are kept stable. So, in the second period, I'll explain how the cause of diabetes changes depending on which part of this system breaks down. Why is it that some people develop diabetes even though they have the same eating habits as others? Actually, there are 3 branching points. To give you the conclusion first, the first one is the case where the key, insulin, is insufficient. And the second is the case where the keyhole is rusted. The third is the case where the receiving tray is too small. You might be wondering what I'm talking about, but it's an easy to understand analogy, so please listen. You understand the first case, where there aren't enough keys, right? Because there aren't enough keys called insulin to open the cell doors. Sugar can't move from the blood vessels into the cells. The organ that produces these keys in the first place is the pancreas in your body. Actually, there's a lot of individual variation in how well this pancreas works. In studies comparing Japanese people and Westerners, it was found that among people with prediabetes, Japanese people actually had a lower ability to produce insulin. In other words, you should know that among Japanese people, there are some who, even if they let their guard down just a little, or even hardly at all, have trouble producing insulin and are more likely to have unstable blood sugar levels. And the next pattern is when the keyhole is rusty. In other words, even though you have the key, which is insulin, the door won't open because the keyhole is rusty. What causes this rust is, the biggest cause is fat, especially visceral fat. Actually, substances that cause inflammation are released from visceral fat, and these substances make the keyhole rusty, making it harder for insulin, the key, to fit in. Some of you might think, I'm not that overweight, so I should be fine. But actually, there's an unexpected pitfall. Even if you look slim, if you have fat in a certain area, it's said that insulin doesn't work as well. Fatty liver is a prime example. It's when fat builds up in the liver. More slim people are developing fatty liver lately, which I've discussed in my videos. In 2018, a study analyzed as many as 300,000 people. According to the research, especially for people with fatty liver, the conclusion was that their risk of developing diabetes in the future was 2.2 times higher compared to those without fatty liver. Even if your body mass index is normal, just having fat on your liver increases your risk of diabetes. To improve fatty liver, actually, the amount of muscle you have is important. If you're interested, please check the description or the card at the top right after watching this video. And the last pattern is the one where the capacity is small, as I just mentioned. It's actually a matter of muscle mass. In fact, since there are times when you can't eat rice, your blood sugar needs to be stored somewhere in your body to some extent, and the main place where it's stored is the liver and muscles. In other words, people with more muscle mass have a larger capacity to store sugar, and for those with less muscle mass, the capacity is smaller. Their blood sugar tends to rise more easily. Furthermore, if your blood sugar rises too much, all the excess sugar gets concentrated in the liver, making you more prone to fatty liver. A highly reliable 2019 meta-analysis involving 60,000 people showed that sarcopenic obesity, which means having low muscle mass along with obesity, puts people at a higher risk compared to those who don't have these conditions. It has been found that their risk of developing diabetes is about 40% higher. In other words, sarcopenic obesity means having low muscle mass and being obese, which leads to inflammation and makes the keyhole rusty, a double whammy. What do you think? These are the 3 patterns that can lead to diabetes. If you get this, it will help deepen your understanding. And while it's important to reduce fat, it's just as important to increase muscle. I hope you understand that. Now finally, in the third period, let's talk about what happens if you leave diabetes untreated. And is it possible to notice it early and take action? I'll explain these points from a doctor's perspective. Here at YouTube Medical University, as an active physician, we share preventive health knowledge that you can use starting tomorrow to become healthier. I'd be happy if you subscribe to the channel so you don't miss any new videos. Also, the content I talked about in today's video, the triggers that can lead to diabetes, has been summarized in an easy to understand single document. We're distributing the PDF file through our official Line account. If you simply type diabetes, we'll send it to you for free, so please consider registering for our official Line account. With diabetes, having high blood sugar itself doesn't cause any pain or discomfort. The most important thing about treating or preventing diabetes is the goal is to prevent serious complications that occur when blood vessels are damaged by diabetes. Let me get straight to the point. There are 3 major and most serious complications that can occur as a result of diabetes. Please remember them by the initials of Shimeji. The first is neuropathy, which is nerve damage caused by diabetes. As this progresses, sensory nerve damage causes numbness in the fingers and toes. You may constantly feel as if there's a thin layer of skin covering your fingers, or experience numbness and pain, which can lower your quality of life. And because you're more susceptible to infections, you might not notice wounds on your feet, which can become infected and eventually require amputation. These kinds of things can happen. And next is the Mi in Shimeji. Mi refers to retinopathy. The retina is, as shown in this image, the part of the eye that receives light on the screen at the very back of the eyeball. This collection of tiny cells is called the retina, and because it performs very delicate tasks, the retina is filled with fine blood vessels. And diabetes damages blood vessels. The tiny blood vessels in the retina are especially vulnerable, so before you know it, your vision can start to deteriorate. And the troublesome thing about this retinopathy is that just like everyone has a blind spot, you don't really notice your blind spot in everyday life, do you? Our eyes are able to compensate for blind spots with both eyes and the brain, so it's hard to notice a slight decline in vision. That's why, if you leave eye problems untreated without realizing it, you could suddenly lose your sight one day. For this reason, I always advise my diabetic patients in my clinic to visit an ophthalmologist at least once a year. If we can detect it early, we can perform treatments like laser therapy because it can significantly reduce the risk of blindness in the future. And the last of the 3 complications is the Eiji in Shimeji, which stands for nephropathy. In other words, it's a disorder of the kidneys. Diabetes is actually one of the most common causes of dialysis. Since the kidneys are also made up of many small blood vessels, they are easily affected first. And the kidneys are also known as a kind of silent organ. For example, if the kidneys had a strength of 10, even if half of that, 5, was lost, you could still function with just one kidney without any inconvenience or symptoms. We can go about our lives like that. So by the time symptoms appear, more than half of the kidney function has already been lost. Sometimes it can't be restored anymore. To prevent that from happening, it's important to have regular health checkups, monitor your blood sugar levels, and check if there's any protein leaking into your urine. These kinds of things are important. I've talked about a lot of scary things, but there is hope as well. There's a large-scale study called the United Kingdom Prospective Diabetes Study that tested the effects of diabetes treatment. In this study, about 3,900 patients diagnosed with type 2 diabetes were divided into two groups. One group received intensive treatment to lower blood sugar, and the other group received conventional treatment. As a result, the group that had their blood sugar well controlled, as I mentioned earlier, reduced the risk of diabetes complications such as those involving the kidneys by 25%. In other words, it's not that lowering blood sugar is meaningless. Please remember that proper blood sugar management can reduce future complications. And there's another interesting and hopeful point. It's called the legacy effect or inheritance effect. In the study I mentioned earlier, those who managed to keep their blood sugar well controlled during the trial, the group not only had a lower risk of complications at that time, but even when followed up for the next 10 years, they had about 15% fewer heart attacks and about 13% lower risk of death. In other words, the benefits gained from good control during the trial continue to have an effect 10 or even 20 years later, regardless of how you live afterward. That's why what's important in diabetes treatment is to lower your blood sugar properly from the beginning. Lowering your blood sugar is an investment in your future health. It's not okay to just leave it a little high. What's really important is to make an effort while it's still only a little high. Now finally, I'll clearly explain what specific measures you should take. Some people may have been told their blood sugar is just a little high, or that they have diabetes or are pre-diabetic but aren't taking medication yet. For those people, is it important to start medication early, or is it more about exercise and other lifestyle habits? There's a very important study about this. In a 2002 American study called the Diabetes Prevention Program, people who were just one step away from diabetes, that is, those with prediabetes, about 3,200 patients were divided into three groups. A group that improved their lifestyle habits, a group that took medication, and a group that did nothing. So what were the results? The group that improved their lifestyle habits had about a 58% lower rate of developing diabetes. The group that took medication also saw a decrease in blood sugar, which might be expected, but the effect was only about 31%. In other words, improving lifestyle habits had the greatest effect. So when doctors and nurses at the hospital tell you to change your lifestyle habits, it's not just about willpower, it's actually backed by data. But even if you try to go to the gym or walk or run for an hour a day, it's hard to keep it up for a long time. And there's also some interesting research suggesting that you might not even have to go that far. They gathered a group of patients with type 2 diabetes, and for all of them, they had them sit for 7 hours. One group sat the whole time, while the second group walked for just 3 minutes every 30 minutes. And the third group did strength training for 3 minutes every 30 minutes. They divided them into these three groups for the experiment. Interestingly, compared to the group that sat the whole time, the group that walked, both the walking group and the strength training group had clearly lower blood sugar levels from that day until the next morning. The next morning's blood sugar level, on average, dropped by 2.7 points. It's just 3 minutes. Just walking or doing squats for only 3 minutes can have an effect. If you spend a lot of time sitting, please try to break up that sitting time frequently. These days, there are things like Pomodoro timers. People who study for long periods use timers and take breaks according to the timer's rhythm. And when it comes to dietary or exercise therapy for diabetes, what's important is to continue without overdoing it. It's said that being able to continue is more important than what you actually do. Why not declare in the comments what you want to start working on from today? Making a declaration will help you stick to it. So here's today's summary. Diabetes is not a disease caused by being careless. Why do people get diabetes? It's because the body doesn't produce enough insulin. In other words, there's a pattern where there aren't enough keys. There's also a pattern where insulin doesn't work well, meaning the keys are rusty, and there's a pattern where there's not enough muscle mass, so the body can't handle blood sugar well. The tray for blood sugar is too small. I introduced these 3 patterns. Even if you look thin, you need to be careful if you have fatty liver. And as for complications, I introduced 3 of them using the mnemonic shimeji. Neuropathy, which causes numbness in the hands and feet, retinopathy, which makes it hard to see, and nephropathy, which affects the kidneys. Please remember these 3. And by properly managing your blood sugar early on, you can reduce these risks. I also talked about the legacy effect. And I also shared some hopeful news. Even at the prediabetes stage, if you change your lifestyle, your future risk can be reduced by about 58%. Since this turned out to be a long video, listening to it multiple times, taking notes as you watch, or even just leaving comments about things you want to remember can help reinforce your memory. If you enjoyed this video, please give it a thumbs up or down. Any feedback is welcome. I'd also appreciate it if you subscribed so you don't miss new videos. See you next time. As a general practitioner, my patients have taught me how to age well after 70, and I want to live that way too. Their stories offer valuable lessons. Is socializing more important than exercise? In medicine, sometimes less is more. These are insights I've gained from my seniors. It offers valuable advice for living healthily and happily at any age. Check it out in the description below.